Precision medicine is the new kid on the block. So we in India, we now practice precision medicine at least in the cancer centers as well as in the corporate sector. Since we have access to multiple organizations doing testing for precision medicine makes things a lot easier. And now we have the liquid biopsy, which can do away with tissue for testing of the cancer cells in the blood. This is a modality which is very useful for the oncologist because there are times when you cannot access the tissue, and especially it is a test which can be repeated, and based on this we decide our treatments. So like for example in the case of lung cancer, where we decide whether the patient has, let's say, EGFR positive or a resistant form of EGFR, then we can target our therapies based on that. So now we have oral drugs which can target the EGFR receptor, the mutation, the actionable mutation, the mutation which leads to the progression of the cancer. This pathway can be detected, and if you can block that pathway, then you can take control of the disease. Similarly, we have the ALK pathway, and you have drugs for first line, second line, and even third line treatments. So you have treatments which are available based on these molecular markers, based on the next generation sequencing, which can go down to the DNA, RNA, and protein level to decide what would be the right modality of treatment. So instead of giving these patients blunderbuss therapy with chemotherapy, you can treat these patients with a single tablet or a targeted therapy as it's known. So like one goes to the shop to get his suit stitched based on the demographics, similarly based on the cancer demographics, down to the basic cell contents like the DNA, RNA, you are able to decide what would be the most appropriate therapy, and there's no room for just giving them treatments where it's going to where it can affect both the normal as well as the abnormal. Here you're only targeting the abnormal, and you're targeting it with specific specifications of the tumor and its behavior so that you can control this disease. Similarly, in most solid and liquid tumors today, we are able to decide what is the most appropriate therapy for patients rather than just giving them treatments which can do a lot of harm to them. So this is what is precision medicine today, and we are getting newer molecules every day. The US FDA approved 3 new molecules last year for multiple myeloma. Similarly, you can have for both solid and liquid tumors, you can have specific therapies. So because precision medicine right now is a little expensive, especially the diagnostic and the newer drugs, but as with any other therapy, as the number of patients are increased on these therapies, as the diagnostic availability is more, the costs will come down considerably and will be available even to the masses in this case. So it is very important that we today use the bench and what is in the lab to help us in deciding therapies. So from the bench to the clinic, we are able to give better care to these patients.